for babies and young children, medication is dosed based on their weight. So you should, every time when you go for their regular checkups, you should find out what their age-appropriate dose is.
With giving the baby medication, what I always tell parents is, one, if you're not sure, always ask. Call, come in, ask us, because it's better to always ask first than to make a mistake, which can sometimes happen.
If you ever look at the bottle, it's going to say under 2, ask a doctor. So you should always try to get that information from your pediatrician. And quick tips are that 1 teaspoon is equal to 5 cc's. Some droppers have numbers on it, 1, 2, 3, 4, 5 cc's. 5 cc's is equal to 1 teaspoon.
When your baby's sick, sometimes what ends up happening is you get flustered, you don't understand, you forget. It's always good to write down how much you're giving and at what time you're giving it. Because if your baby's sick and he has a fever and you give him a dose and you notice that 2 hours have passed and he's still sick, sometimes you're just with sleep deprivation and you don't remember, you might give him another dose or you might give him a too high dose. So you always want to write down everything that you give him when they're sick. Now, if your baby's an infant, what you always want to make sure is that less than 6 months, Motrin is not recommended. You should never be giving your baby ibuprofen. It's a little bit too strong for the baby. Over 6 months, either Tylenol or Motrin are just fine.
If the baby spits up right after giving the medication, it's okay to give it again. If 15 minutes has passed, you shouldn't repeat the dose because the medication has been absorbed by the body already. And if you have a question where you're unsure of what to do, you should try to get in touch with your pediatrician.